Hi, I'm Coresa Magruder, and this is my patient education video. This is my 12-year-old daughter who is going to be acting as my pregnant patient. Hi, Emmeline. How are you feeling today?
Pretty good.
Good. Dr. Peters asked me to come in and explain to you the things that need to be handled before your gestational diabetes test on Thursday. Are you familiar with that process and what needs to be done?
No, not really.
That's fine. I brought in a brochure. This talks all about what gestational diabetes is, the complications that arise from it, and why we test you. We do this on all pregnant women during their second trimester. We want to make sure that your body is functioning the way it's supposed to be during pregnancy. Are you familiar with what diabetes is?
A little bit.
Okay, well, let me kind of go over that really quick. Diabetes, there are two different types of it. But in the more common one, your body is not able to produce enough insulin to counteract all of the sugar that enters your body. Now, in gestational diabetes, often that can result because the placenta that the baby is inside produces a hormone that enables your body to release that insulin. So if your body doesn't have enough insulin, you end up with hyperglycemia, and that can lead to other complications. We just want to make sure that the sugar in your body is regulated. So that's why we test you. It doesn't mean that it's going to be positive, but if it is positive, then the doctors will either have you modify your diet or do exercises. In the worst case scenario, they'll give you special medication to make sure that your body is handling it properly. So this kind of goes over the prereqs, but I just want to go over it with you to make sure that it's solidified in your mind. So 1 out of every 10 women test positive for gestational diabetes. So if you are one of those 10, one of those 1 in 10, then Dr. Peters will go over further what we need to do, but let's just make sure that you're prepped for the test before then. So your test is on Thursday, right? It's early in the morning?
Yes.
Okay, so they're going to ask you not to eat or drink anything for 12 hours before your test. You can have water. That's perfectly fine. You want to always keep yourself hydrated, especially when you're having blood drawn. But do not eat. So I think that your test was scheduled for 7 a.m. Is that right?
Yes.
Okay, so after 7 p.m., you're going to want to eat nothing and drink nothing except for water. I do that because it needs to be a fasting test in order to get the most accurate results. Now, we do ask also, now it's a 2-hour test, which is kind of a lengthy time period, but we want to make sure that you have somebody who can drive you there and pick you up, just because you won't have eaten for 12 hours and it might make you kind of lightheaded. So when you show up, the doctor is going, or the nurse, whoever is performing your test, is going to give you a very sugary beverage to drink. It's going to taste like flat orange soda. It's not very good, especially on an empty stomach. But you're going to drink that in a short period of time. Usually they give you between 5 to 7 minutes to get that all down. And then they'll take your blood, your draw right away. And then they're going to wait an hour. And when you're sitting there, you can't leave the office. You have to stay in the office. So bring something to read or something to do to keep you entertained for that time frame. And then after that first hour, they're going to take your blood draw again. And then you're going to have to sit and wait for another hour. And then after 2 hours, they're going to do a third blood draw. So they'll have one before you take the drink, an hour after you take the drink, and 2 hours after you take the drink. And that is going to help them to know if your body is handling the sugar properly or not. After the 2 hours, you're free to leave. We do want you to have somebody there that can take you, because you're going to have an empty stomach and you're going to have nothing except a very sugary drink in your system. So make sure you have somebody with you. So now this gives you all of that information that I just told you, but I want to make sure that you understand. So can you tell me what you need to do the night before and the morning of the test?
So I need to fast for 12 hours, eat nothing except for water, and then I need to have someone pick me up, drop me off and pick me up, and I can't remember the third one.
That's okay. It's all here in the brochure. When you show up, you're going to get that drink to drink. They're going to take your test your blood right away, and then they're going to do it again at the 60-hour and the 60-minute mark, and then the 120-minute mark too. That's the entirety of the test, but make sure you bring something for you to do, because you're going to be sitting there for 2 hours. I'm going to give you this brochure And then Dr. Peters will contact you after the results to let you know whether or not we need to do anything further or whether you're just good to go.
Okay.
Do you have any other questions for me, though?
No, I do not. Thank you very much.
Absolutely. I hope you have a really nice day.
Thank you.
Mm-hmm.